Dear students, welcome back. In the previous session, we have discussed about orthokinematics of the hip joint. Now in this session, we are going to discuss about osteokinematics of hip joint. This can be studied in two ways. One is motion of femur at the hip joint and motion of the pelvis at the hip joint. So now first we are going to discuss about motion of femur at the hip joint. The range of motion available at the hip joint, which can be commonly interpreted through the movement of the femur, and this can be best visualized in this way. Okay, so and the range of motion is also influenced by whether the motion is taking place actively or passively, and whether passive tension in the two joint muscles are avoided or not. Okay, now we will see the range of motion of all the movements which are taking place at the hip joint. First, the flexion of the hip is generally considered to be 90 degrees. So the flexion of the hip generally considered to be 90 degrees when the knee is in extension. So when the knee is in extension, the range of hip flexion is about 90 degrees. So, and if the knee is flexed, and the range of knee flexion can be extended up to 120 to 135 degrees. Okay, what happens means when the knee flexed and the passive tension in the two joint hamstrings is released. Normally hamstrings are present on the posterior aspect. So if the knee is extended, that means the hamstring is crossing two joint muscle. So the knee extension as well as during hip flexion, what will happen? So these hamstrings become taut. So then it is obstructing further range of motion. So during extension or at the knee, the hip flexion is only 90 degrees. When the knee is flexed, so then the hamstring muscles are relaxed. So the tension which is created in the hamstring muscles is reduced. Then the range of flexion is increased to 125 degrees to 130 degrees. Okay, yes. Next, if you see the hip extension, when hip extension is considered to have, so this is the hip extension, is considered to have 10 to 30 degrees of hip extension. 10 to 30 degrees of hip extension. Okay. When hip extension is combined with knee flexion, passive tension in the two joint rectus femoris may limit the movement. So normally rectus femoris is present on the anterior aspect. When knee flex, if you flex the knee and then you can extend, then the passive tension which is created in the rectus femoris will limit the motion. Okay, and next movements is the abduction and adduction. So now first we'll see the range of abduction. So the femur can be abducted, so this is the abduction, can be abducted to 30 to 50 degrees. 30 to 50 degrees, and this adduction is taking place by 10 to 30 degrees. Okay, so these are the ranges from normal anatomical position to the functional range of motion. Okay, now, and the abduction can be limited. So this abduction can be limited by a muscle called gracilis muscle, and adduction is limited by tensor fascia lata muscle and its associated iliotibial band. so which is present on the lateral aspect, which is restricting the adduction movement. Okay, next, coming to the other movements. So what are the movements still remaining? So rotational movements, that is medial rotation and lateral rotation. Okay, so this is internal, that is called medial, external rotation or lateral rotation. This is the normal position of the limb. So you can easily find the internal rotation if it is in closed back position, causes some feet is also internally rotated, whereas in the external rotation it is also externally rotated, the feet. Now actually what happens, what is the range of medial and lateral rotation of the hip? So the medial and lateral rotation of the hip are usually measured with the hip joint in 90 degrees of flexion, okay, giving a range of 45 to 60 degrees of lateral rotation and 30 to 45 degrees of medial rotation. So normally it is tested when the person is lying, and now the knee is flexed, the hip joint is flexed at 90 degrees, and then they check for medial rotation and lateral rotation. Okay, so the medial and lateral rotation range is 45 to 60 degrees of lateral rotation, and medial rotation is 30 to 45 degrees. So normally the internal rotation is smaller than the external rotation range of motion. Okay, so the femoral antiversion is correlated with decreased range of lateral rotation and less strongly with increased range of medial rotation. Okay, so normally the antiversion, so we have seen in the torsion, isn't it? So the angle of torsion increased in the antiversion. So if the angle of torsion increased in the antiversion, so in the antiversion means already the femoral head is laterally rotated from the normal position. So because of this antiversion, it limits the lateral rotation. That means it decreases the range of motion of lateral rotation and less strongly increasing the medial rotation, because the space for posterior gliding of the femoral head is more, so it causes more medial rotation in the case of femoral antiversion. Okay, so normally the normal gait on level ground requires at least some of the following hip ranges. So for normal gait it requires 30 degrees of flexion, 10 degrees of hyperextension, and 5 degrees of both abduction and adduction, 5 degrees of abduction and adduction, and 5 degrees of lateral rotation and internal rotation. Walking on uneven terrains or states will increase the need for joint range beyond that required for ground level. And also some activities such as sitting in chair or sitting cross-legged, then also all these ranges are going to change. So these are all about the motion of the femur at the hip joint. Okay, in the next session we are going to discuss about the other way of studying osteokinematics at the hip joint, that is motion of pelvis at the hip joint. Thank you.